Hi, this is Elisa back with justorthopedic.com, and I'm sitting here with Dr. John McGarry. And we're going to go right into another topic, and it's rotator cuffs. So my curious question here is, what are some of the treatments that you do for a rotator cuff injury?
Yeah, well, there are different kinds of injuries on the rotator cuff. You can have a rotator cuff sprain, where it doesn't necessarily tear, or you've irritated the rotator cuff, or you're getting some rubbing on the rotator cuff, which is oftentimes referred to as impingement, without a tear or without a very major tear. Then you have partial tears, which are certainly different percentages of how much of the rotator cuff tendon is torn. And then you have full thickness tears. So they can all be treated differently. And kind of backing up, and what a lot of people may not know is, what is the rotator cuff? Well, the rotator cuff is a group of muscles, 4 of them, that wrap around the ball and pull the humeral head into the socket to stabilize the joint. And they work to keep the ball right in the center of the socket, so all their big muscles, the deltoid, the chest, the back muscles, can do the major lifting, while the small muscles stabilize the joint. And so when you have different tears, you can certainly start on the easier end. If it's a partial tear or just a strain, you can start with anti-inflammatories, physical therapy, rest, and you can also proceed to doing things such as steroid injections, also physical therapy. And if those fail, or if it's a full thickness tear, oftentimes we recommend surgery. Because once you have a tendon that actually detaches from the bone, the muscle recognizes that it detaches and will undergo changes over time. It will start having fatty infiltration, atrophy of the muscle, and eventually you pass the point of no return where you cannot reattach that tendon and then get the muscle to work. So in full thickness tears, we oftentimes, again, take into position the patient's age, their activity level, their function, and see what their goals in life are, because a lot of times we do repair those.
And the majority of the time with certain rotator cuff tears, the majority of the time there is no surgery often needed?
Yeah, the majority of the time there's not, especially because a lot of them are partial tears which can respond to conservative treatment. So I think it's hard to answer that question, because when they come to your office, they're hurting. So a lot of times, even though they may have had a rotator cuff for a while, something brought them to your office, and they may be getting to the point where it's edging on maybe a surgical treatment. But again, we do try conservative treatment first in most cases.
Very good information. Again, thank you so much. Ladies and gentlemen, Dr. John McGarry.